Hi, thanks for tuning in to episode number 67 of the Doctor Podcast Show. We really appreciate that you're tuning in, and please subscribe and follow Doctor Podcasts and also like and repost this episode. That allows us to get even more and greater guests in the future. So we really appreciate that. Today we have a great guest, and we're going to discuss a very important topic, which is in the news lately. Our guest today is Dr. Sanam Hafeez. Dr. Hafeez is a psychologist. She's the founder and director of the Comprehend the Mind Comprehensive Psychological Consultation Services Center in Forest Hills, Queens, New York. And she is a neuropsychology expert, and you can find out more about Dr. Hafeez at her website, which is comprehendthemind.com. And we'll have that posted on the interview video so you can go there easily. So, Sanam, thanks very much for taking the time from your busy schedule to join us today on Doctor Podcast. We really appreciate it.
No, thank you so much for having me on.
Yeah, it'll be very interesting. Today, we're going to discuss three topics that you're an expert in. One is learning disorders or learning disabilities. We're also going to discuss ADHD or attention deficit hyperactivity disorder. And we're also going to discuss autism. These are topics that are in the news a lot, and there appear to be more and more cases of these. Now, these conditions affect mostly children, adolescents, but more and more it's affecting young adults and even middle-aged adults as well. So tell us how you got interested in psychology.
So my story is very simple and kind of sweet and innocent because I was in high school and I decided I was going to be a psychologist. And what I do now every day is very different than how I thought I'd have this couch. In the 90s, you thought
Okay.
that's what psychologists did. And I was going to have this office on Park Avenue and I was going to be a psychologist to the stars. But I enjoyed people, and I was sort of like a vessel. Like everyone just came to me unsolicitedly, just gave me information that I didn't ask for. And so um and I thought I was good at working with people. I was good at giving people advice. I was good at figuring people out, and I genuinely enjoyed it. And so I was one of the rare people who went to college completely set on my major. I did never deviated from it. I declared it right away and I stayed the course.
Wow, that's a great story. You seem like the kind of person that people want to talk to a lot and reveal their deepest secrets to. You kind of suggested that. Is that the case?
Yeah, it very much is. But I'm also I think I kind of had this reputation from a very early age that I gave sound advice and I didn't gossip. Like I didn't, so I think people trusted me. There was something, I guess, hopefully trustworthy about me. And I think once you become a licensed medical professional in any field, I think one of the things you take very seriously is confidentiality. So
Right.
that served me well.
That's great. So tell us about the Comprehend the Mind Center in Queens, New York City, and what sorts of services you provide there and to what types of patients.
Yeah, so I founded Comprehend the Mind, or Comprehensive Consultation Psychological Services, although it wasn't exactly called that at the time, back in 2006. And I started out really providing evaluations. There was a huge need for bilingual or evaluations that were culturally sensitive. I'm in New York City. And believe it or not, almost 20 years ago at this point, there weren't that many people who could do what I did. There's still actually not a lot of people who can do what I did. There's certainly a lot more, but there weren't enough people who did bilingual evaluations and assessments. So I, at the time, was working at Coney Island Hospital, which is a New York City hospital in Brooklyn.
Right.
And I was doing these evaluations on the side. And even at Coney Island, my job was a neurodevelopmental psychologist. And I loved the idea of assessments. And it was kind of like, I call it detective work, figuring out what's really going on through testing. And so I was doing a lot of assessments on the side. And it just grew to the point where I had to quit my job and do this full time. And
Yeah,
so
I
what
didn't
started
have
out,
enough time a day, right, to
yeah,
do it
yeah,
all.
exactly. Even though I was younger, so I seemed to have a lot more energy back then. But I was one person and I thought it'd be a nice little solo practice. except it just grew and grew and grew because I started to get contracts from the city of New York and City University of New York, which is the CUNY school system, which is massive, and school districts that learned about me and thought, oh, maybe you can do, oh, you speak these other languages? Well, do you speak these? And before I knew it, I was hiring contractors and other psychologists and basically um, running a little business. So that's how it came about. And now we don't really have contracts. We primarily work. It's evolved to where it's almost 50-50, meaning it used to be, I would say maybe 70-30, meaning 70-30 children, 30% adults. It then kind of became the gap got smaller and smaller, and we're probably 50-50 now, where we see 50% adults, 50% children. And to your point, where a lot of adults are now, finding that they have a lot of these symptoms,
Right.
and a lot of the children that we saw, 10, 15, 20 years ago are now adults. So we've continued to evaluate and, seen them as well.
Very interesting. What languages do you speak and are you fluent in to help people who don't speak English well?
Yeah, I don't get to really use them as much anymore, but I can speak Urdu, which is my native language. My family's language is Urdu, even though funny enough, was always dominant in English, but I did learn to speak it. And believe it or not, I honed and sort of perfected it once I started doing this work in psychology because there was such a big need for it. And I've also picked up Hindi, which is similar to Urdu, and Punjabi. Again, I almost never get to do it. I did get a forensic case today, which requires an Urdu speaking neuropsychologist all the way
Oh,
from, I think, Arizona. So I'm excited about that if I get to go on and be an expert witness.
right. Now, I looked at your website and now you have a whole team of people there working with you. It's not just you because you'd be working 24/7. So
Yeah.
tell us about your other team members that work with you.
Yeah, so over the years, so initially it started out really being a lot of contractors. And then as the practice grew and evolved, I started hiring people. And that became really the way this team that came together once I had my children. I had my twin boys 9 years ago. And I just thought I wanted to be a hands-on mom, but I needed to keep this place running and I needed to keep the people who worked for me employed. And the only way to do that was to start bringing on other psychologists. And yes, I've got a beautiful team for about 5 psychologists. All we primarily do is assessments. We've got a team of psychometricians, people who help us score and kind of manage. It's think of paralegals. You know how they basically run the lawyers' lives. That's how these guys run our lives. And then we've got a pretty decent billing team and administrative team. And I couldn't do what I do without them. They allow me to be a little bit of the rock star that I feel like I am in psychology, where I get to do fun things like interviews like this and,
Right.
uh, media stuff and forensic stuff and write my book and write a chapter. I couldn't do it if I was seeing patients all day. So they're incredible. And I still do see patients every single day.
Oh, that's great.
Yeah.
Tell us about, you mentioned forensics. What does that mean? Psychology and forensics.
Yeah. So I guess I've been doing that for a while as well. And I initially started out being an expert witness for the court system in New York. And it's grown where I do primarily private work, and you have to be careful with it. I enjoy it very much. I joke that I get to play a lawyer, by doing forensic work, and
Right.
it's very, very interesting work. It carries a great deal of responsibility, right? Because the court system, the judges, they're depending on your expertise and your witness to guide their decision making in the process.
Right.
And I take it very seriously. So I do some work with catastrophic injury. I do medical and educational malpractice or educational law. I do catastrophic injury. So I don't do personal injury. I don't do the stuff, where people get into car accidents and sue
Right.
for, I do catastrophic injury and I do custody cases. I do divorce stuff,
Wow. Sounds
immigration.
like you're working 25/8, 24/7 isn't enough for you. It's 25/8. That's
Yeah.
great. It's keeping you busy. So I want to discuss learning disabilities. We see that a lot in the news these days. A lot of children are diagnosed with that. Can you tell us what that is and what causes it?
Yeah. So learning disabilities in a nutshell is a neurological impairment in the way you learn, right? And it's a very complex thing to really diagnose because first of all, there could be so many different reasons why you struggle with learning. For instance, I saw a gentleman yesterday, and his cognitive functioning, his intellectual IQ was like here, it was average, right? It was decent. But his learning was really low, like low average. And so I said to him, he grew up in a very tumultuous time in a very tumultuous household and inconsistent schooling. And I said, it's hard for me to tell how much of this is just poor formal learning or poor schooling versus an inability to learn. It's hard to tell, right? So, but that's what learning disability is, that in spite of proper, appropriate services and interventions and learning, there is a gap, a discrepancy between your ability and your achievement. And that defines a learning disability. And it's usually a neurological issue with the way you process or retain information, and just an inability to do it. But, I may be jumping ahead in your questions, but let's say reading disability, which is a very common one that we see. It could mean anything from poor comprehension to poor decoding skills, which is more dyslexia, to like a visual dyslexia where you can read, but you have a difficult time perceiving or analyzing forms and figures on a paper because there's some visual impairments. So it can really span a lot of different things. And my job as a neuropsychologist is get to the bottom of what it is that's causing what just appears to be a reading problem on the surface.
Right. What age do learning disabilities or problems start? When can you see that in kids, and what are their symptoms that they notice, or most likely parents or teachers notice?
Yeah, so I think that there are enough signs where people can look out for them early on, like maybe age 3, 4, 5. But up until the age of 6 or 7, it is not atypical for children to reverse letters. We call that transposing letters, like a B that's the circles on the other side, or a 6 versus a 9, and certain sounds. But we expect that by second or third grade, that should even out. That should no longer be a problem. So if that's happening, they probably need an evaluation. Now, you can have dyslexia and still read well. Like once you get the hang of reading, you might comprehend really well. But then we have people who start out reading well and then they hit, end of elementary school, maybe middle school, and suddenly they read, but they can't comprehend, they can't stay with what it is that they're reading. And there you start to say, well, could it be attention? Could this be an attention issue? Is this a processing issue? Are you losing your place on the page? Is it a visual issue? Is there something else that's happening? Maybe a language-based issue with regard to learning, with reading. So you have to, at different stages of a child's life or an individual's life, you have to consider a lot of different things when it comes to a learning problem. And that's what makes neuropsychology so complex and so specialized. That's why it's such a specialized niche.
Yeah, the brain is a very complex organ, and we're just beginning to understand it at this point. So part of the problem is that we don't completely get how the brain functions, and
Right.
it's different in different people. Are there any environmental factors causing learning disabilities, or is it just genetic, or is it a combination of both, do you think?
The majority of the time, learning disabilities are very much a genetic concept. You probably have a parent, an uncle, an aunt, a grandparent, another sibling who also has a learning problem. It doesn't have to be the exact same learning problem. So you may have, dyscalculia, but you may have a parent who has dyslexia. Um, Environmentally, obviously, a child being born into a low socioeconomic status, a child being exposed to lead poisoning, there's certain head injury, let's say, or poor nutrition. Obviously, those things can contribute to learning problems as well.
Right. Are there specific tests or metrics that you and your team can test to decide what the problem is?
Yeah.
You mentioned dyslexia and dyscalculia. Those are two common ones, and there's something called dysgraphia as
Mhm.
well. Can you tell us what those are, and how you figure out what somebody has?
Yeah. So dyslexia, to just simplify, is a reading problem. And it can, like I said, vary from your speed in reading to your comprehension in reading to your difficulty decoding words, right? Dysgraphia is a problem with writing, both the mechanics of writing or the content that you put together and organize while you write. And dyscalculia is, sort of what the name suggests. It has to do with math. It's a math learning disability. And so let's say you may do operational math, but then you struggle with word problems. And now usually a reading problem causes an issue with the way you do word problems because you have to comprehend what the question's asking for, right? So there it kind of becomes a little bit more blurred. We have a lot of testing. So we usually start out with something that assesses cognitive functioning. So we have tests like the Wechsler scales. There's Wechsler scales for the preschool or very young population, the WISC, which is for the older up to age 17, and then the adult population. It's called the WAIS, the Wechsler Adult Intelligence Scales. I like the Stanford Binet, which is a fantastic measure, but they haven't updated that in over 10, 15 years. So we try not to use it as much. We even have we have several IQ measures, but we even have something called a TONI, which is a test of nonverbal intelligence.
Hmm.
So we have several different ways to assess intelligence where we try to minimize the effect of language or being able to, let's say culturally understand the Western norms so we can truly assess someone's cognitive functioning.
So basically, you have these tests that are sort of quantitative, and so that you can come up with the correct diagnosis. Is that
Yeah.
correct?
Correct. So once we have the cognitive functioning down, we then do academic functioning tests. And so there's a more generalized academic functioning test. And then if we have specific concerns or the patient presents with specific concerns, let's say about dyscalculia or reading, then we have additional neuroexecutive tests that we perform for that particular type of learning problem.
You ever, from your test results and just from speaking with the patient, decide that it's actually a medical neurologic problem and you have to refer to a neurologist?
Yeah, I mean, listen, if there is a deficit, it's a learning problem, right? But we very often end up making referrals to ophthalmology, to neurology for, if we suspect a brain injury. Sometimes the parents are not even aware of the fact that the doctors will notice in working with the patient, they'll say, is there a history of absence seizures? Because I noticed that he, kind of blanks out and it seems more neurological than just ADHD, or they're patients who have tics, or their patients that come in knowingly with a history of neurological problems. Plenty of kids who've had brain injury, who've had tumors, they've been operated upon. So, we have to take into account how much of the injury or the disability have to do with the illness, how um, I guess idiopathic it is versus I mean, it's still, they're both idiopathic, but how much does it arise from a medical condition rather than just a neurological one?
There's been lots of talk in the news lately that the foods we're eating, processed foods, are somehow injuring us and possibly injuring our brains. And also the plastic pollution, microplastics, nanoplastics, may be causing some problems as well. Is there any evidence that those are connected to learning disabilities or not yet?
I mean, listen, we know, for instance, lead poisoning can cause or
Right.
exacerbate learning disabilities. I think we're living in a culture where if you really wanted to go on a mission and try to find evidence that this is happening, that there's a connection, you probably will. What I will say about it is it's concerning that we consume and ingest so many chemicals and plastic particles that we know for a fact are carcinogens, and they're not good for you. And I love the world of supplements and biohacking. It's just a personal thing for me. I enjoy it very much. But I'm also quite level-headed about some of these things. I don't think you need to be a professional to know that organic or homegrown foods or simplified, having an apple rather than a candy bar is good for you. What I will say is that a lot of sugar, for instance, causes inflammation, and we know the inflammation is the culprit in almost everything, right? From heart disease.
Yeah, it seems that way.
Yeah, we used to think that beef caused cholesterol and that's why people got heart disease. No, beef causes inflammation, which causes inflammation in your arteries, and that's why you get heart disease. Now we know that Even Alzheimer's is almost like diabetes type 3, right? We know
Yeah.
that inflammation from sugar is also highly related to something like Alzheimer's. I've been doing a lot of research on Alzheimer's, and they say that 4 out of 10 Alzheimer's cases are, I don't want to misspeak. I really am a stickler for statistics and I don't like to say things that are not accurate. But one of the studies, a meta-analysis that I read were that 4 out of 10 Alzheimer cases were either genetic, completely genetic, and you can't do much about them, or and six were because of environmental factors, because of your diet, or vice
Right.
versa. It might have been 4 or 6. It could be either or. I'm sorry, I'm not 100% sure. But the bottom line is that there's a lot we can do to mitigate some of these genetic factors, or sort of, you know, things that we've kind of feel like, well, I was predisposed to this. It was going to happen anyway. Yeah, you are. You're predisposed to a lot of things. And yes, they might happen. But I think we would both agree that if something was going to happen at 60 or 65 and you can push it off to 70 or 75, we'll all
That's
take it.
right.
Yeah.
Right. Now, can you have a learning disability and still have a very high IQ? For example, can you have an IQ of 120 but have a learning disability? And how do you test for that and figure that out?
So I see a lot of very, very bright people, children and adults. And one of the things I'm very fond of diagnosing and actually putting it down as a diagnosis is the concept of giftedness. Learning disability. So it does not, having a high IQ does not preclude you from having a learning problem. It does not preclude you from having ADHD. It just means that you have a brain that fires on all cylinders all the time. And it's a very interesting thing. And so, in my practice, we didn't do this up until a few years ago, where we started seeing a tremendous number of gifted people. And I'm not quite sure what turned the tide. We used to see gifted people off and on, but the majority of people who came to us were people who struggled in some way. After the pandemic, people started coming to me and saying, the pandemic broke me. I don't know what to tell you, but the
Yeah.
pandemic did something to people. I think there's so many stratas to this. I think it'll take us decades before we can really even out what happened because of this very unprecedented, novel thing that happened to us. And then we all like snapped back. I mean, the human race is incredibly resilient. I mean, it's incredible, right?
Right. We're
This
here
is
still.
this is why we're zooming. Zooming wasn't a
Right.
thing. I used to go into people's studios. So, and this is also why people like you and I probably work a lot harder, because we can't get away from the computer and the phone.
Right.
Um, and a lot of other people as well. I think it's
Uh,
it's
Let me ask you this. Once you've diagnosed a learning disorder, let's say it's dyslexia or dyscalculia, how do you treat that? What do you do to fix that problem?
so there are many, many different ways, but I just wanted to wrap up my thought about the giftedness. So when
Yeah.
you look at the bell curve, if people on this side of the bell curve are intellectually deficient, because the lower you go toward the left, meaning they have a low IQ, why aren't we coding people that are on the higher IQ? So I started seeing a lot of people who were professors and PhDs and tenured people who were saying, I can't keep it together. I used to churn out this many papers and I haven't been able to finish a project since I got tenured. Or I think I'm autistic, and human resources has come down hard on me because I struggle with people's pronouns, or I struggle with people's names. And, so I see a lot of gifted people. And in doing that, I sometimes find that even though they're very successful, a lot of them do have learning problems as well. So it's a very complex population that we work with. Now, if you have a learning disability, just like with the majority of things in life, if you catch it early, there's a lot more you can do with it than when you catch it later. However, and you can quote me on this, what I really say a lot more these days is that there was never a better time to be dyslexic or dysgraphic, right? Because 5, 10, 15 years ago, we simply did not have the technology that we have today, the talk to text, even Siri on your phone or Alexa. Dictation softwares are built into pretty much everything, right? So I think people can use assistive technology, especially if they're older, because it's very hard for them to go back and remediate something that didn't get caught when they were 7 or 8 years old. So if they're 7 or 8 years old, there are things that we can recommend at the school level, that is broader than just giving a child extra time on tests. there are programs, like for instance, there's a multisensory program called the Orton Gillingham, which is a reading program. There are tools that, assistive technology tools for spell check. We can have someone work with a child on, in an individual basis to help them figure things out with math, executive functioning issues that often show up in math. And once we assess them, we can tell you where exactly the problem's arising from. So you can design a more tailored accommodation rather than just an all size, one size fits all kind of an approach. And we find that that works very well.
Right. So you have all sorts of technologies and methods once you diagnose the patient in order to help them. And what's your success rate like in general treating these learning disorders or disabilities?
We don't treat, we diagnose. And the way we treat, so, in terms of the recommendations, is we have our patients come back every year and a half or so. And so we keep reassessing to see what we call response to intervention. How did you do with the things that we suggested? And then based on that, we reassess and we tweak some more, and then they come back and we, tweak some more because a person's needs change
Right,
continually. So a year and a half, 2 years makes a huge difference to a child, from the third to the fifth grade.
right,
And we keep supporting them. And, I am fond of telling parents that, especially whether I've seen them for a long time or not, because we live in a world where accommodations have become much more commonplace than they used to be, that the real world out there doesn't have accommodations. So my attempt or my philosophy is to explain to families when working with children is don't make this a crutch for your child. When they get out there, there's no extra time. You know,
right,
you know, there are tools that you can use, but a lot of parents push for accommodations. And in doing that, like opting their kids out of statewide or citywide tests, I say let them take it. They need to learn how to take tests. They need to
right.
learn how to do things within an allotted, period of time. So I've got a bit of a sort of a balanced approach and a kind of I think, and this is maybe partly responsible for my success in the real world, is that I have a no frills approach to both testing and the recommendations that I make.
I like your approach. Now, you mentioned you don't actually treat. Do you refer these patients to somebody to do the treatment and follow up on it before you reassess them again in a year or so?
Yeah. So, like I said, we make a lot of referrals to people who are, ophthalmologists, neurologists, psychiatrists, a speech therapist. So we make a lot of referrals to people who can do additional diagnosing. We also know that the majority of these providers are more than happy to take our very big 40, 50-page report and, excuse me, and make treatment decisions based on our testing, because we've done all the work. You don't really
Right.
have to do much anymore. And it can make a huge difference because, I mean, you're a psychiatrist, I believe, correct?
No, I'm an ophthalmologist,
Oh,
actually.
you're an ophthalmologist, so you know a
I
bit about.
always wanted to be a psychiatrist, though.
I'm
And
so
about
sorry.
half of, I do about 50% psychiatry for my patients anyway, even though I'm an ophthalmologist. They're
Yeah,
always asking me for advice of all kinds.
yeah, of course. And bartenders, don't forget bartenders.
Right. That's my next episode. Number 68 is bartenders and treating various mental conditions.
Yeah,
Just kidding. Just
yeah. So,
what about the next topic is ADHD or attention deficit hyperactivity disorder, which is in the news more and more and more. Almost everybody is now diagnosed with that, kids at least. And I'm seeing a lot of patients in my ophthalmology practice who tell me they were recently diagnosed with that. I used to think it was just a condition in young kids, but now I'm seeing middle-aged adults who tell me they have that. So tell us what ADHD is and what causes it and what is it about? What are the symptoms that people might have from it?
there's so many things that we're learning about ADHD. When I started out, it was just a dysfunction of the frontal lobe and, issues with, can you still see me? Okay.
Yeah,
Uh, a dysfunction of the frontal lobe and people who struggled with, basically a lowered electrical, sort of a circuit basically in that part of the brain, and it caused deficits in paying attention, remaining seated for a long period of time. Now we also know that there is some dysregulation in the way dopamine is produced and processed in the brain. So we know that people who have ADHD have more of a propensity toward things that provide them with an immediate dopamine hit, because they don't produce as much of it, which is why delayed gratification is a problem for them. So there's just so many things that we're finding out. And used to be where
Mm.
you had ADHD and people still correct me, no, I don't have ADHD, I have ADD. And I go, there's no such thing. Not anymore. We had that bout back in like maybe the 90s and early 2000s. It's ADHD, either the inattentive type, the hyperactive type, or the combined type. And we also find that people who think they just have the inattentive type don't quite recognize that hyperactivity is impulsivity. It's cutting people off, interrupting people, jumping the gun and hitting send on an email, or, buy in cart without really thinking of like looking through what they've put in the cart. So, and then when I say that, they go, oh, then I have that one too. Because, you don't have to
So-
bounce off the walls to have ADHD, the hyperactive type.
Right. So now, again, same story. Is this a genetic condition, environmental, or a combination too, or we're still not quite sure yet?
So it's primarily because it's neurological in nature. It's primarily a genetic condition. We find that an overwhelming number of people who have ADHD also have a relative with ADHD, and it's not very hard for them to diagnose or suss that out. Like, oh, yep, my mom is very much like me. Got an older brother who can't hold down a job or always struggled with school because he couldn't stay put and whatever it is. I
Right.
do think that in the last several years, because of the phone, I think there's a growing body of well, it's not just literature, but there are um, a lot of people who present with symptoms of ADHD only to find that they have executive functioning deficits, which is not ADHD. They have a lot of difficulties regulating their time on a screen, which is not necessarily ADHD. It can be caused by anxiety. There's an overlap of a generally missed diagnosis of bipolar 2 disorder, which can look like ADHD on the surface. So it's very important to do enough of a deep dive. So our assessments look very much like neurological, psychiatric, because there's just a significant amount of overlap. I mean, listen, the brain is this very powerful little organ, and you can't say that something that happens here doesn't affect something that happens there.
Right. Now, I checked the CDC website, and they estimate that about 11% of children between age 3 and 17 have ADHD. And in the year 2022, which is the latest data, they added about 1 million more kids to that, making it an even higher percentage.
Mhm.
Why is there this sudden epidemic of ADHD? Is it because it's really increasing in incidence, or is it that we're diagnosing it more frequently, or a combination of the two?
A little bit of both. I feel like we're definitely diagnosing it more because, and a lot of my adult patients, or even the parents of the patients, the younger patients that I see, it's a very common conversation in my office. It goes something like this. He won't sit down and finish his homework, or he won't sit down and finish his meal, or he won't sit down or he won't go to bed when I tell him to because he won't get off his iPad. And then they
Mm.
follow it up with, sometimes the mom, but it's mostly the dad who'll go, I was the same way, except God help me. If I had done that, my mom or dad would have whooped my butt. So we also have these kids coming up in a very different time, right? And parenting has changed, and a lot of times for the better. But I think parents have a harder time setting limits and boundaries around, you know, no, you must do this, and a lot of the times I end up working with the parents than I do with the children, where I teach them how to modify their behavior so their child can be more responsive, and that doesn't come with yelling and a lot of times these parents feel awful about how they end up yelling at their kids, or they find themselves just stressed out because they're engaging in behavior that, I don't mean like hitting, but they can get more aggressive than they'd like. And I go, and how does that feel? And it turns into their therapy session because they feel awful about that, right? And the house feels hostile and uncomfortable. And it turns out that these kids are really running the show. And I said, and I always say to them, I go,
Those things. Yeah.
20, 25, 30 years ago, if two adults were talking, a child thought several times before he or she interjected, right? And these kids will interrupt their parents as they're talking to me. So a lot of this has to do with parenting. And I tell parents, look, for you to tell your child to put the iPad down, you have to put the phone down. So a lot of this has to go, it goes back to who you are and the things that you have to do. And it probably wouldn't surprise you that I end up seeing entire families. And parents go, "Can I make an appointment? Can I get it evaluated too? Do you see adults?" And so before I know it, I'm seeing the entire family, which is a great way to do it because then I can set up a systems approach. So
24/7 again. So you mentioned computers and screens and phones. Do you think that exacerbates or makes this ADHD problem worse?
that's the environmental piece you just mentioned. So I think people who might have gotten away with, let's say these dads who are now highly functional professionals, let's say, they have their struggles. But the reason for their success is that they were not constantly distracted by a screen.
Hmm.
They actually picked up a book. They actually finished. If they needed to do research, they went to the library, they looked things up. So part of our brain is just not functioning the way it's supposed to or wired to because answers should not be this readily available to us, you know.
So AI is bad?
I don't think AI is bad, but even before AI, the fact that
Right,
I learned to cook on primarily on recipes from Google.
right.
But had I learned to cook sooner than that, I think I did buy some books and stuff. I would have had to open it up and actually look at a book and look at the directions. There was no, I mean, I actually still don't like videos. I jumped to recipe, but it makes it almost takes away from a part of your brain processing where the answers are always available to you. I've had parents who've said, I would go home, my mom and dad wouldn't be home, and if I wanted to eat something, I figured it out. If something happened, a pipe broke, I figured it out. Kids don't have to figure out a lot anymore. And it's true for adults as well. A lot of adults don't have to figure a lot of things out anymore. And yes, the phones and they've made our lives a lot easier, but from a brain perspective, we've taken over the brain's job in figuring things out for us. And
That's
like any
a
other muscle,
interesting perspective. Our brains are kind of getting sloppy and lazy, it sounds like.
yeah, I mean, I wouldn't go as far as saying atrophy, but we're not, it's a muscle that functions best when you're using it. But if you're mindlessly scrolling for hours, what do you think your brain's doing? It's like, all right, I'm going to bed. This is silly.
Right.
Yeah.
Another controversial issue is Adderall, which is being used for treating ADHD. Again, the CDC says that about 52% of people who are diagnosed with ADHD are on Adderall, and the prescriptions are just skyrocketing. What's the story with Adderall? Does it work? Is it necessary, or can you just do cognitive behavioral treatments?
I'm going to give you a twofold answer. Yes, Adderall works. It's a very potent but very effective drug for people who have ADHD. It has a tremendous amount of abuse potential, which is why the state became maybe 10, 15 years ago, when I started getting a lot more referrals from neurologists and psychiatrists, it's because they were no longer willing to get in trouble for prescribing Adderall. And the push was hard. Everyone, and even today, you can find it in a dorm room.
Right.
Adderall gets passed around like a party drug. So I think Adderall does work. I think the people who actually have ADHD, it functions, it works very well for them. Adderall carries a risk. I tell people that it is one molecule away from crystal meth. It's a very potent drug. And so, in the people who have ADHD like symptoms that are really brought upon by bipolar, Adderall can actually trigger a manic episode. So, one of the things that I caution psychiatrists and neurologists in my report, it's a bold sort of note. Please be cautioned this patient has bipolar disorder or has a propensity toward a mood disorder, please be careful about medicating them with a stimulant because they often miss it. And so I've seen patients where they've become aggressive, suicidal, or even homicidal on Adderall.
Really? Even relatively low doses?
I mean, it depends, right? It depends on how well monitored
Right.
it is. Yeah.
There was an article came out last week in one of the major medical journals that showed that people who are on high doses of Adderall have a increased risk of severe manic episodes and even psychosis. So
Yeah. Yeah.
it has lots of potential problems.
Very
So,
careful with it. Yeah.
right, but apparently all the college kids are using it to help them study and pass exams, and
Yeah.
it's a big problem out there.
Yeah.
Um, the next topic is autism. What is autism? We're hearing a lot more about that as well. And how's that different from ADHD and the learning disabilities? And how do you differentiate autism from those?
Yeah. Lately, this is my favorite topic. So I've known autism the entire time that I've been a psychologist, even before when I was a student, obviously. And nothing has changed or changed the landscape of neuropsychology like autism has. I'm very interested in speaking about this to you. So autism is a neurological condition. It is not psychiatric, it's not behavioral, it's a neurological condition in which, and we still don't know everything about it, and we don't know how much of it is ideological and how much of it is, genetic and how much of it is environmental. But I think it's safe to say that the cases of autism have skyrocketed in the last decade or so. And, you know, usually people who have autism have a relative that might have anxiety, social anxiety, or autism. Of course, it wasn't always diagnosed in previous days. When I first started, working with autism, I worked at Coney Island Hospital in a neurodevelopmental center. The autism we used to see was the very, I don't even think it's fair to call it Rain Man autism because Rain Man was, Asperger's, not really truly full blown autistic. But autism used to look like a severe impairment in speech, very poor eye contact, very poor social, not just capacity, but interest, really. And then every now and then we would see people who were less debilitated, they were brighter, they were more capable, but then you saw deficits in their adaptive functioning and their social functioning, and it looked more like Asperger's. And back then with the DSM 4, we had other categories of autism, one called Rett syndrome and childhood disintegrative disorder. And then when we couldn't figure out where they fell, we would call it PDD NOS, pervasive developmental disabilities or disorder, not otherwise specified. Okay. Then DSM-5 came along. And we as psychologists and
The
psychiatrists,
DSMs, just for the audience, are specific diagnostic codes that psychiatrists use.
and we use them, we diagnose based on the DSM. And it's a set of criteria
So
that
psychiatrists and psychologists use that. That's the standardized way to describe mental disorder conditions.
right. So if there are two mental health providers that are unsure about where someone falls, there is diagnostic criteria in the DSM-5 that tells us what criteria a person has to meet in order to diagnose or to be classified as such. So when DSM-5 came around, we got rid of all those categories. We just said autism is going to get coded on a spectrum of mild to severe. And in some ways, I do think that that's a good thing. But what started to happen was social media took a hold of autism. It's like someone leaked it, and then someone said, "Oh, I think I have autism." And it's become where the most displeased people that leave my practice or decide not to return are the ones that get told by me that autism isn't some trendy diagnosis. You can just, I mean, I don't use those words, but you don't just decide you have autism. If you didn't have autism or autistic traits before the age of 3, you're unlikely to have autism, right? It's autism can mimic a lot of the autistic syndromes or symptoms like sensory issues, right? Or poor attention, executive functioning, poor social functioning, poor language functioning are attributable to a lot of different things.
Right.
right? It's the other day I had a young girl, maybe 8 or 9 years old. She has three brothers who are autistic. In fact, the other one of the brothers was here who was in my office, and he was textbook autistic, talking the entire time, eyes darting all over the room, complete oblivion to his environment. Meanwhile, his sister was on an iPad and she wasn't very engaged, but just the fluidity in her movement, just the eye contact, just the way she communicated or answered me back. And she wasn't monotone, there was inflection in her voice. And I said to mom, I said, she's not autistic. And the developmental pediatrician has long suspected that she may have some level of it. And so he sent her to us, and we've worked with him for a long time to do a test called the ADOS. The ADOS is sort of the gold standard in autism called the Autism Diagnostic Observation Schedule. And so my practice, we provide that. I actually, do a lot of didactics and I make sure that my staff is trained on it every couple of years to stay up with the current research. And even that is not a standalone measure. It's a kind of thing where you need to feel it. There's almost like this fabric of autism that people who've been doing this a long time can tell you they know. And there are a lot of people who get very angry at me, adults, who are convinced because TikTok or Instagram or Google told them they have autism and they will not take no for an answer.
Really. Wow.
Yeah.
So, what symptoms should a parent look for and at what age that are suggestive of autism and that they should bring the child to you?
So, at a very young age, if you have a child who's not speaking, who's not making eye contact, who's stimming, meaning they're twirling about, flapping their hands, rapidly blinking their eyes, they're very highly sensitive to noises, to textures, to food textures, to fabrics, there's a good chance that they may be on the spectrum and you need to have them evaluated right away. There is no cure for autism, but early intervention is the most effective form of treatment, and you can help a child reach their potential if you intervene and provide them with the services. And as adults or as children become, kind of go through the stages of childhood and become adults, while we can't treat autism, what we can treat are the things that autism exacerbates, like depression, anxiety, ADHD. So those things would be treated
Yes.
like you would treat those things, like you would treat them with medication, let's say, right? So if a child is aggressive or agitated, you treat the agitation like you would with, let's say, risperidone. If they were, if they had anxiety, you might try fluoxetine. If they have ADHD-like symptoms, whether they have ADHD or not, because it can be difficult to sometimes parse out ADHD from autism, because autism gives rise to a lot of things. Um, then you might try an Adderall, you might try something that's a non-stimulant if there are concerns about their behavior. The thing that can be tricky with autism is cognitive behavioral therapy, right? Because you can't, cognitive CBT, as you know, is an incredible form of therapy. It's almost as effective as medication for a lot of things, except it takes a tremendous amount of commitment and, understanding the rules of the game, understanding how to reset cognitive or restructure irrational thoughts and beliefs. And a big part of autism is that they have a poor theory of mind, meaning they have a hard time seeing themselves or other people um, in like sort of in a parallel to them, or to understand that there's a world or a perspective outside of theirs. But that is the cornerstone of autism. So to have them work with a cognitive behavioral therapist who doesn't know how to work with autistic people, who can't give them, they need sort of like clear black and white definitions, and they don't read between the lines very well. So it needs to be someone who knows how to tell them, I'd like you to do this, this, this. And they can be very effective with people who are autistic and training them to make eye contact and asking questions in how do you do turn taking in a conversation, right? And they can role play with them, they can script that for them. And so while autistic people can learn those things, they will always look awkward and stunted or somewhat stilted doing that, because that's the thing, that's the gig. With autism, it's not fluid, it's not natural.
Right. So we
I hope
can
I
treat,
explained that.
yeah, so we can treat the symptoms that they display, but we can't treat the underlying condition or get rid of it.
Exactly. There's some research that suggests that people who are autistic have a similar electrical sort of like a misfiring that you see in epilepsy. And so there's a lot of research that's concurrently going on. Can you treat people with autism with, you know, anticonvulsant medication or
Right.
epileptic medications? Yeah. Yeah.
Interesting. We're still learning. Again, the CDC has interesting data. Apparently, the incidence of autism has almost tripled in the last 5 years. Is that again due to increased numbers developing this, or is it more diagnosis, or both? What do you think about that?
Yeah, I think so. There are certain countries, by the way, that had report a much higher incidence of autism, which makes me believe that there may be something more environmental that's going on. I do think you remember this. I I think you might be in New York, and you might remember that there was a time where we thought that women in Long Island had a much greater incidence of breast cancer. Do you recall this? This is like maybe 20
Yeah,
years
yeah,
ago. Yeah,
right,
I grew up hearing that, only to find out that women in Long Island were more affluent and went to doctors and got diagnosed for breast cancer. And
right.
that's the difference between them and women in the inner city. So it wasn't something in the water. It was just that they had access to healthcare. So I think what's happening is that when people are, including medical providers and educational providers, when they're sort of stumped and they are met with parents who are gunning for this autism diagnosis, I think that is the primary reason that we've seen such a tripling of autism cases. But I can tell you, as someone who was diagnosing autism 10, 15 years ago, the number has absolutely gone up.
Mm.
And I'm not sure what's to blame for that. It could be a genetic mutation, it could be environmental causes. Yeah.
What about the controversial vaccine theory? There's still a lot of people out there who think that certain vaccines cause autism. What's your
Been
opinion on that?
it's been debunked over and over and over again. They're just the
That's
mercury
not
levels
true.
are not high enough. It's absolutely not true. And I don't deal with that as much anymore, but the anti-vaxxers gave me quite a headache for several years because they wouldn't vaccinate their kids. And then the New York City put in a rule that you couldn't attend a public school if you were not vaccinated. And so they would try to get me to write all kinds of things to give them a medical exemption if they couldn't use a religious exemption. So yeah, been there, done that. No, vaccines do not cause autism.
All right, that's great to know. Now, people listening to this are going to flock to your office now, so you're going to be even busier than ever. But for people who don't live in the New York City area, how do they find a qualified psychologist like you, or even psychiatrist, to diagnose and treat these conditions? Is there a way for them to find people in their area in California or Nebraska or wherever they are?
Yeah, look, we live in New York City where we have plenty of practitioners and specialists and clinicians, and it's even then it's hard to get an appointment with someone who takes insurance or has reasonable rates. And so, you, I let me say this: that if you are a parent listening to this and you have a child, you pay taxes, and the first line of defense is your school. Ask the school to evaluate your child. It's free of cost. Your taxes pay for it, and they have an obligation to test your child. Now, they can't diagnose your child, but they can at least put some supports in place so your child doesn't, if you're a parent, a semester is too much time if it's being missed or your child's not getting services. So do that. Then you can seek out developmental pediatricians, you can seek out psychiatrists, you can seek out psychologists. I will be honest, neuropsychologists like myself are very much a rarity, but if you
Mhm.
can't find someone, they're usually in a hospital setting or a university setting. The wait times are exceptionally long. I'm very proud of the fact that you can start an appointment with us within a couple of weeks because it's a process and it takes about 4 to 6 months. But this is why I have 5 people who do nothing but testing all day, right?
Right.
In some other places, you don't even get seen for a year and a half, even in New York City.
Really?
And if you do find a neuropsychologist who's private, the cost is seven, eight, $10,000. I mean, it's crazy. We take insurance, commercial insurance, and people
No.
can't believe they think we're we they think we're a mirage, like this can't be real, but we do take insurance. And even my out-of-pocket rates are actually pretty fair and reasonable. But, I do think that there is a tremendous need for a proper, standardized, qualitative assessment and the discretion of a doctor level person who's looking at this and really spending time saying, well, because it looks like this doesn't mean, if it walks like a duck, acts like a duck, it's got to be a duck. No, sometimes it can be something else because neurology, psychiatry, mental health are very complex areas, and you need someone who's got the expertise to do it. So when you're looking for someone, look for credentials, look for licensure, look for their training, and don't be afraid to ask questions. Yeah, if you look for a provider, whether you find them by Google or your insurance directory, ask them questions. Don't be afraid to find out, what degrees do they have? What qualifications do they have? Do they do actual testing? Are they just going to meet with you? Are they going to meet with your child? Are they going to send scales to the school? If you're an adult, are they going to do actual testing with you? What is their methodology to get to that diagnosis?
So the
Don't be,
testing that we discussed earlier, the quantitative testing
yeah,
is very important.
yeah, it's very important, but the problem with that is it's very expensive, and very few people are trained to do it. But that doesn't mean that your standard, garden variety psychiatrist or psychologist can't use some level of qualitative measures like a scale or something that can give them more data, even a computerized test for ADHD, than just speaking to you. And sometimes you have to dig a little deeper than just surface to get to the bottom of what's going on. And family history, I can't stress it enough. Ask your parents, ask your siblings, ask your uncle and aunts about what's going on because your family history is actually quite important.
Right, because all these conditions, as you mentioned, tend to run in the family and there's some genetic component.
Sure, for sure. Yeah.
Any other great advice you can give us in closing?
I would say I love the fact that Google and social media has provided such a breadth of and a wealth of knowledge to people that they can learn about themselves. And, there's something navel gazing and a little narcissistic about us as a human race where we like to know more about ourselves. But
Right.
take what influencers are telling you with a grain of salt. Trust your mental health, your neurological health to an actual professional with a medical degree, a PhD, a Psy.D, someone with a doctorate, with a license, who can give you real information based on the research that's out there and their, lifetime experience of clinical practice. Anyone who has a phone can have a channel on the phone on a social media app. That does not make them a specialist.
That's a good point. Yeah, there are a lot of people who are not doing that.
Yeah.
Yes. So this has been very educational and informative for me, and I'm sure the audience out there as well. We've learned lots of invaluable information that will be helpful to many parents and patients. So I want to thank you for taking the time from your very, very busy schedule to join us today on the Doctor Podcast Show.
It was lovely. I loved it. Thank you so much. And I really do hope that you have listeners who will benefit from this.
Thank you.